everybody. Today we will try to understand pathogenesis of bismuth. So bismuth belongs to the row 6 and the column 15. They already have developed the features of row 5 that they are creative, and now also they have the features of row 6 that of the responsibility and the leadership qualities. But belonging to the column 15, they have lost their power to be a particular leader or to take that particular responsibilities. So they are constantly in a search for having a support or support so that they can get the power again in the form of support for their particular responsibilities and leadership qualities. But they are too weak to preserve that power again. Because of too weak to preserve that, physically also they are too weak for that particular power. So physically also they have loss of the power in the especially in the form of esophageal sphincters, so that leads to the vomiting. Loss of control or power over the rectal sphincters, that leads to the complaints of diarrhea in them, that we will see afterwards. But first we will see that how the loss of power and continuous desire for the support leads to the forsaken feeling in them, because as there is no one around them, so constantly they are having a feeling of forsaken, that I am not having any support. But due to that feeling, they are constantly in a pain physically but as well as mentally, that we call as in term as anguish. So anguish means physical and mental pain both. कॉन्स्टेंटली हम बोलते हैं ना कि एक पर्सन बहुत ही ज़्यादा दर्द में है, उसको बहुत ही ज़्यादा पेन है कि मेरे साथ ही ऐसा क्यों, वाई आई एम अलोन, वाई देर इज नो वन फॉर सपोर्टिंग मी. सो दे आर कॉन्स्टेंटली इन अ melancholy and the sad mood, that is in anguish. Because of that also they become very much anxious and also discontented, that why only me, why only I am suffering, I am always unsatisfied with whatever I have, whatever I am facing. That discontented nature is present, and especially for this desire of support, it is seen in the child when they are ill, that always they have a desire to hold the hand of the mother or any other attendants which are present around them. So they have constantly have the desire in the form of for the support, and that support is in the form of holding the hands in the case of children. In the adults, that support is in the form of support from other person. So that is how the bismuth is from mental aspect. So due to that so much anguish and anxious nature, the vagus nerve is getting stimulated. Because of stimulation of the vagus nerve, as it is supplying to the respiratory and the GIT system, both of them are affected, but mostly the GIT. Due to the overstimulation of the vagus nerve, the secretion of the prostaglandin is getting increased. As prostaglandin is a local hormone, there are different types of the prostaglandin having different function. But here, especially the PGE2 and PGF2 alpha gets increased. Due to increase in them, that decreases the absorption of the sodium and the water from the gastric lumen or intestinal lumen. Due to that, all the secretions, all the sodium and other electrolytes and even the water is not absorbed in the GIT but gets excreted. That is in the form of stool. So they get the cholera-like diarrhea in them. So this is how the PGE2 and PGF2 alpha increases in C. And it is also because this prostaglandin is also increasing the peristaltic movement. That also leads to the conditions of diarrhea. Apart from that, the another prostaglandins like the PGE1, E2 and A1 also gets increased, and that prostaglandins leads to decrease in the HCl secretion. That causes indigestion problems in them. So many times in the vomitous material or in the stool also you can see the undigested material present in them. Even after a day is passing, the stool will be having undigested material because indigestion is seen in them. And along with this, when the vagus nerve is overstimulated, it also leads to the catarrhal inflammation in them, and because of that it leads to the gastritis that will progress and leads to the ulceration, peptic ulcer in them. And as the bismuth is a syphilitic remedy, that leads to the more and more progress towards the destructive pathologies and finally leads to the gastric carcinoma in them. But because of the stimulation of the nerve, the person will be having the pain along the distribution of the nerve in its course. So that leads to the neuralgia of the neuralgia like complaints, that is known as a gastralgia in them. So that is a condition seen in them. But along with this, because of so much so dehydration in the vomiting and the diarrhea, the person will develop blue ring around the eyes, pale earthy complexion is seen in them. That what we call as a Hippocratic face of the person. That is how the person develops Hippocratic face of the bismuth. But along with this, sometimes the because of increase in the prostaglandins, the person's heart is also increasing the contractions. That leads to the palpitations and the angina pectoris. And even after some abdominal or surgical operations of the abdomen, because of the abdominal surgeries, also the vagus nerve gets irritated, and due to that also Fata is a rubric which is having only the one remedy, that is bismuth, abdominal operations after or surgeries after. So in that, bismuth is also the remedy. Because of that only, irritation of the vagus nerve only, the GIT of the person gets disturbed after the operation. So this is how the person of bismuth is having different type of pathologies, and this is how the prostaglandin mechanism is seen in the case of bismuth.